Now, this is the lateral view. Okay, so lateral view of skull. So Norma Lateralis. The main bone at the Norma Lateralis are, see here, frontal bone. Here we can see parietal, temporal bone, zygomatic bone, maxilla, nasal bone. Here lacrimal bone and the mandible. So, and along with that, one more bones comes here. Here, this side. This bone name is a sphenoid bone. See here, this region. Okay, this bone is sphenoid bone. Next one, remember, this is the main bones I told. Okay, so here, meeting point of front. This one point is there here. I'll show you this part. See here, this side. See this area. This point is for the meeting point of four bones. Which and all? See here, parietal comes. Here comes the temporal bone. See, temporal bone comes here. Parietal bone, frontal bone, and one more is what? Sphenoid. The sphenoid bone, greater wing of sphenoid bone comes. This is the meeting point. Okay, which corresponds to sphenoid frontalla in fetal skull. Okay, this point. Now another point is that to remember, and this is surgically important. This part, this area of the skull is very thin compared to other regions. Okay, so when you are taking a section, so you can make out that area is thin. Look at this part. This is section of the skull. So can you see this area? See one small thin part you can see here. See here thicker, here thicker. This area is thinner. Okay, now so that is the, see sideways you see, this is the part of pterion. Okay, so that I told now. Then next point is that here inner aspect of this pterion, here the artery goes. Okay, the middle meningeal artery pass through that. So any accident takes place means so it in the fracture of this bone leads to the the bleeding. Okay, takes place from this artery. Okay, hemorrhage takes place. Now look at this part here. This point, and the bone of that the arrangement of the bones is one thing to remember here. See here you can see the skull bones diploid bone it is. Okay, that means here compact, and middle one spongy layer. So that arrangement is present only in skull bone, that we are calling diploid bone. You studied, no? There are three, actually mainly we are telling two types. The third type is diploid. One is the compact, one is spongy bone. Okay, and third one is diploid bone type. Now look at this here. Here we have a asterion. This asterion means is the meeting point of parietal, occipital, temporal, and which this area, this point is there. This corresponds to mastoid frontalla in fetal. And there are areas here. One side we can above cyclic arch. This we are calling that we are calling temporal fossa, and this area we are calling the infratemporal fossa. Okay, these two regions are there, and zygomatic are dividing this area into two. This temporal fossa region. See this infratemporal region, and here we have this is the pterygoid plate. The lateral pterygoid plate you can see sphenoid bone, and here one depression mandibular fossa we can see, and here one opening is this is the external occipital, external auditory meatus. Okay, external auditory meatus, mastoid fossa are here. So these are just to remember, and here this one pterygoid fossa, this one this pterygoid plate is coming here. Pterygomatic comes here. This is the infratemporal fossa. Maxilla comes here. Pterygomaxillary fissure you can see. That leads to one palatine fossa. So fossa is infratemporal fossa. Through the maxillary fissure, it goes to another fossa. That region leads to another fossa. That is pterygiopalatine fossa. Comes. So this is the area. Remember divisions. Okay. So this much